Everyone. Welcome to our Florida CHES Continuing Ed training. I would like to give a big thank you to the Florida Department of Health for their funding and their support of this initiative and for today's training. There are a few housekeeping items I would like to share with you on today. This webinar is being recorded. We will turn our cameras off during the presentation. And during the webinar, please feel free to use the chat function and we will answer any questions at the end of the presentation. Following the webinar, we are going to send you a post-webinar email, and it's very important that you pay attention to this part because it's going to include a link to the recording, but it's also going to share the presentation slides as well as a survey that is important that you fill out in order for you to get credit for today's training. So participation in this 1-hour live training gives you 1 CHES credit. And after the webinar, that evaluation link is going to be sent to you via email. You'll need to complete the evaluation in order to receive your certificate of completion and your credit. Credit will be given to you through the Clinical Directors Network Incorporated. As a CHES presenter, I have no disclosures regarding financial relationship or unlabeled investigational uses of any products. So my name is Stephanie Moody, and I am the Health Equity Coordinator with Healthy Birthday Count the Kicks. Here at Healthy Birthday, we have a laser focus on stillbirth prevention, but we will also focus on eliminating the racial disparities that exist and persist. As some of you may know, statistics show that Black women are 2 times more likely to lose their babies to childbirth, to stillbirth, and 3 to 4 times more likely to die while giving birth. My responsibility is to look at the inequities in birth outcomes in your state and develop strategies to address it. Part of the strategy is to build partnerships with community organizations that serve within the marginalized communities so that we're not only educating expectant parents, but also educating the providers, the doulas, midwives, home health and maternal health workers as well. Our goal is to work together with those who are the boots on the ground, getting the information into the hands of those who are most impacted by stillbirth, moving us to a place where race is no longer a predictor of stillbirth. My passion for this work in stillbirth prevention came after finding out about the inequities that persist in stillbirth outcomes in the African American community. My passion for this fight against preventable stillbirth inequity comes from the impact that stillbirth had on our family after my sister Angie lost her daughter Jasmine to stillbirth in the early 90s. While we were working on the campaign to educate faith-based leaders and community leaders in Des Moines, my son and daughter-in-law became pregnant. I asked Courtney if she had ever heard about Count the Kicks and if she was using the app, and she used it. On her due date, Court thought she was in labor, but noticed Luna wasn't moving as much. Originally, they told her to drink water, lay on her left side, time contractions. She was a first-time mom, and there's times where we can feel a little anxious about giving birth, but Court decided to go into the emergency room anyways. She provided the doctors there in triage with the information she had from tracking Luna's movements and was able to prove that Luna was not moving like normal. They examined her and found that there were 2 health issues that would have prevented our Luna from having a healthy birthday. Since then, I've continued working to educate and empower expectant parents and maternal health workers on the importance of counting as well as tracking their fetal movements. Saving babies, yes, this is my dream job, and I am honored to be able to share this information with you all on today. I always like to start these presentations with a feel-good story that gives a good overview of Count the Kicks. It highlights our free Count the Kicks app. This was done on Good Morning America. It shows the power of mom being educated on fetal movement and speaking up when she notices a change. This mom spoke up when she noticed a change in baby Ruby's movements. Finally, the impact of storytelling helps other expectant parents to understand the importance of counting and tracking those fetal movements in the 3rd trimester. After Ruby's story showed on Good Morning America, our app downloads skyrocketed and baby Ruby's story led to at least 2 additional baby saves that we're aware of. Let's listen to how Emily saved baby Ruby's life by using the Count the Kicks app.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble. For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby. Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
It's stories like these that are reminders of why we do what we do every single day. It is so worth it, and I'm grateful to be a part of this team. So let's talk about how we hope to save more babies together. We have a highly effective, evidence-based stillbirth prevention campaign. We developed an early warning system for expectant parents, and we are saving 1 in 3 at-risk babies right here in Iowa, as well as in other states. Our campaign is ready to go. We are excited to save more Florida babies with your help and with the help of the Florida Department of Health. Now, I'm sure that you all probably know these definitions, but I like to go over them to ensure everyone is on the same page on the webinar. I always like to start by sharing the differences in the definitions of stillbirth, miscarriage, and infant mortality, but more importantly, the statistics that are associated with these terms. You would be surprised at the number of maternal health workers who are unaware of the differences between stillbirth and infant mortality. Stillbirth is the loss of a baby after 20 weeks of pregnancy. On average, we lose 23,500 babies to stillbirth annually in the United States. Miscarriage is the loss of a baby before 20 weeks of pregnancy. Infant mortality is the death of an infant before his or her first birthday. Now, on average, we lose around 22,000 infants annually before their first birthday. But notice that the stillbirth rate is slightly higher. So we must recognize that it is just as prevalent as infant mortality. Yet no one is talking about it. If you ask expectant parents about the Back to Sleep campaign, most can explain what it is. This is not to speak down about these campaigns because they are both necessary. The point that I want to make today is that we are losing too many babies in both situations. And there are preventative measures that exist for both and should be discussed by OBs, doulas, midwives, and maternal health workers everywhere. It should be just as common to share stillbirth prevention methods with expectant parents as it is to talk about prenatal vitamins. The only way to impact these losses is by starting with awareness and moving to solution. Our Count the Kicks app is a viable solution to reduction of the stillbirth rates, and I'm going to show you how. The likely causes of and contributors of stillbirth identified by the study are listed in order from most common to least common. Number 1, pregnancy and labor complications. Problems with pregnancy likely cause almost 1 in 3 stillbirths. These complications included preterm labor, pregnancy with twins or triplets, and the separation of the placenta from the womb, also called placental abruption. The placenta provides nutrients and oxygen to the fetus. Pregnancy and labor complications were more common causes of stillbirths before 24 weeks. Number 2, problems with the placenta. Almost 1 in 4 stillbirths were likely caused by problems with the placenta. One example of a placental problem that causes stillbirth is insufficient blood flow to the placenta. In the FCRN study, placental problems were the leading cause of stillbirths that took place before birth, and these deaths tended to occur after 24 weeks of pregnancy. Number 3, birth defects. In more than 1 of every 10 stillbirths, the fetus had a genetic or structural birth defect that probably or possibly caused the death. Number 4 was infection. In more than 1 of every 10 stillbirths, the death was likely caused either by an infection in the fetus or in the placenta, or by a serious infection in the mother. Infections were a more common cause of death in stillbirths before 24 weeks than those after. Number 5, problems with umbilical cords. Problems with the umbilical cord were considered a probable or possible cause of about 1 in 10 stillbirths. For example, the cord can get knotted or squeezed, cutting off oxygen to the developing fetus. This cause of stillbirth tends to occur more toward the end of the pregnancy. Number 6, high blood pressure disorders. High blood pressure in the mother, whether due to chronic high blood pressure or preeclampsia, also contributed to stillbirths. These types of stillbirths were more common in the end of the 2nd trimester and the beginning of the 3rd compared with the other parts of pregnancy. And then number 7, medical complications in the mother. Problems with mother's health, such as diabetes, were considered a probable or possible cause in fewer than 1 in 10 of the stillbirths. Stillbirth is definitely a significant issue that is rarely talked about or even discussed. Nationally, we lose 1 in 169 babies to stillbirth. Racial disparities persist and exist. Black moms lose 1 in 96 babies. This means that Black moms are twice as likely to lose their baby to stillbirth when compared to their white peer, friend, or neighbor. Hispanic moms lose 1 in 199, Indigenous moms 1 in 138, white moms 1 in 204, Asian Pacific Islanders 1 in 233. Stillbirth is just as prevalent as infant mortality. Families are 10 times more likely to lose their baby to stillbirth than they are to SIDS. In the United States, we lose 65 babies or a busload of children every day. Let's take a look at Florida's stillbirth rates in comparison to the national stillbirth statistics. According to the Florida Department of Health, in 2019, we lost 6.8 babies for every 1,000 live births. There were 1,515 fetal deaths in 2019. When you break it down by race, Black women came in significantly higher than their white peer, friend, or neighbor. Black women are losing 11.5 babies per 1,000 live births. Here is what the Iowa data shows for the life of our campaign. The red line at the top represents the national stillbirth rate, and the dots and trend line beneath it is our Iowa rate, starting at 2003 and going through 2020. Where the blue dot meets the red line at the top is 2008. That is the year our campaign started. You can see the trend line goes down from there. One important thing to note is that the majority of the United States has remained pretty stagnant, whereas Iowa's rate has continued to decrease. Of course, there are some years that it fluctuates, but it's important to look at data yearly as well as on averages. There are many outside factors that could cause a spike in stillbirth outcomes, like a large outbreak of syphilis or even COVID-19. There are a variety of factors that could lead to an increase or a decrease in a state's stillbirth rate. But one important takeaway in Iowa is that when you look at the risk factors like the smoking rate and obesity rate, they've increased during this time frame, while our stillbirth rate still saw a steady decline, while the rest of the country remained stagnant. Since the launch of our campaign and our laser focus on educating and addressing the inequities that exist and persist in stillbirth outcomes, we have seen a 32% reduction in the stillbirth rate in Iowa and a 39% reduction in the stillbirth rate for Black women in Iowa. That is fantastic news. And we want to bring that same reduction to the stillbirth rates in Florida. By working together to educate expectant parents as well as all maternal health workers on counting and tracking fetal movement in the third trimester, we can not only impact lives, but together we can save lives. We are better together. The 2020 preliminary Iowa stillbirth rate is 4.0 fetal deaths per 1,000 live births. It is the second lowest Iowa stillbirth rate on record after 2018 and one of the lowest in the United States. As mentioned on the previous slide, there is a large divide when it comes to those who are more likely to experience a stillbirth. I wanted to take a moment to share what research has shown to be some contributing factors to this. Please note that Healthy Birthday Inc. has reviewed research articles, and these points come from various articles, and we would be happy to share them with you if you are interested. The question is, why are there such large disparities for stillbirth? Research shows that there are a lot of contributing factors to the racial health disparities in stillbirth. Researchers point to the following as causes for the disparities that exist and persist in stillbirth outcomes for Black women. Systemic racism, when policies, practices, representations, and norms work together to perpetuate racial inequality. Examples include higher infant mortality rates, less school funding, harsher punishment for crimes, and less income. Toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African American woman in a systemically unjust society and all that comes with it, have led to real and pervasive health issues for Black women. Epigenetics. Your genes play an important role in your health, but so do your behaviors and environment, such as what you eat and how physically active you are. Epigenetics is the study of how your behaviors and environment can cause changes that affect the way your genes work. Unlike genetic changes, epigenetic changes are reversible and do not change your DNA sequence, but they can show how your body reads a DNA sequence, thus impacting your health. Predispositions to certain conditions that may lead to stillbirth, like gestational diabetes, preeclampsia, or high blood pressure, which are all linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions. There's also issues with access to healthcare and socioeconomic barriers. Surprisingly enough, research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby to stillbirth than a high school-educated white woman. You may wonder, what is Count the Kicks doing to reduce disparities in stillbirth outcomes? Well, one thing we've done is we've hired me as a health equity coordinator. So I'm on staff to ensure that we're looking at everything we do, including reviewing our programming, marketing, social media, and even our educational materials with that equity lens to ensure our educational materials are culturally competent and proficient, and we're able to reach those who are most impacted by stillbirth. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. One of the ways we utilize funding is we translate our app and brochures to meet the needs of those where English is not their first language or the refugee population. We are an inclusive organization with 100% of our board and staff being trained on anti-oppression and structural racism. Even those who work within our office administratively are trained bi-monthly on diversity, equity, and inclusion. We work within the marginalized communities by improving programming based on the lived experiences shared with us by women of color. As we learn more about the issues and barriers that they face, we identify solutions and we work with our partners on implementation. Our app is currently in 12 languages. We have culturally appropriate educational material, including low literacy brochures that are more picture-based for the refugee population or for those where English is not their first language. And we have also created videos featuring women of color so that those who have the materials in their hand or those who are watching the videos are able to connect with the face that they see on the screen, as well as updated our printed educational materials and frequently asked questions in multiple languages. So this is the research article that started this entire campaign. The article was entitled Reduction of Late Stillbirth with the Introduction of Fetal Movement Information and Guidelines, a Clinical Quality Improvement. I love this quote by Dr. Ruth Fretz, who is an assistant professor in the Department of Obstetrics and Gynecology at Harvard Medical School. She's also a part of our medical advisory board. She said, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and speaking up if they notice a change. Count the Kicks was named a best practice by the Association of Maternal Child Health Programs, also known as AMCHIP, earlier this year. After a thorough scientific review, the leading maternal health association in the U.S. determined that our program meaningfully engages stakeholders at all levels of practice, and it ensures improving health equity as an integral component of overall program sustainability, has been externally validated by another entity, and replicated with similar positive results in another context. We are proud AMCHIP members and hope that you will order our educational materials, download our app, and share us on social media, or find other meaningful ways to help us to prevent stillbirths. As part of the It's Hear Her campaign, the CDC identified tracking fetal movement to reduce maternal mortality in the United States. The CDC listed 15 urgent warning signs for pregnant women and the importance of paying attention to babies' movements as one of the key markers. Check out their list of warning signs and share with every expectant mother that you know. Definitely use the image from the Hear Her warning signs, and what you can do is grab their downloadable JPEGs if you Google it so that you can share it with those expectant parents. Let's talk quickly about some things you may be thinking. Maybe you are thinking, yeah, this is great, but it's just going to increase expectant parents' anxiety. I'm here to tell you that is not the case. As you can see from this study and what is quoted here, one potential side effect of routine monitoring of fetal movement can be an increase in prenatal visits, either outpatient or in hospitals. However, most research has not found this type of increase to be true. Usually the fetal movement count, or FMC, is reassuring to pregnant women and prevents unnecessary visits, end quote. And through our own research by the Des Moines University and the Harkin Institute, where we surveyed our app users, the researchers found that 84% of app users stated that regular tracking was associated with feelings of bonding, and that 77% of app users reported feeling less anxious. In fact, the researchers stated that using an mHealth app to empower mothers to monitor their baby's fetal movement shows through preliminary research that the mHealth app increased awareness of a change in fetal movement and a reduction in stillbirth. Because what we do is educate and inform. Now you have an educated pregnant person with data at their fingertips to be able to show and say to their provider, look, this is not my baby's normal movement pattern. And the OB can then determine, based on the statistics that they see, what the next steps will be. Additional benefits to maternal fetal movement monitoring can include reduction in preterm birth rates. Fetal growth restrictions can be identified much earlier. Women bond with their baby. It also increases the bonding with spouses, partners, or siblings while the baby is in utero because the entire family can get involved. One can count while the other one is tapping the baby foot on the app. Fetal movement monitoring may also detect health issues that mom may be experiencing and not aware of. Women who have stillbirths are at a substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of the fetal death. There are several other key research studies that you can review. All of this will be linked on the resources page of this training and can also be found at our website at www.countthe.kicks.org. Let's take a look at implementation of Count the Kicks and how you can integrate it into your practice. But first, I want us to dive into exactly what Count the Kicks is and how to use the app. As I mentioned earlier, Count the Kicks is our stillbirth prevention campaign. It's evidence-based and mom-centered. When the founders created this campaign, they did so wanting this to be an empowering campaign for expectant parents. We all know how sad and how difficult stillbirth is to talk about. And I'm talking from firsthand experience. Our family endured the heartache of stillbirth when my sister lost her daughter Jasmine in the early 90s. We endured a loss prior to the app being available to expectant parents. What the founders wanted to do is create this campaign that would easily allow providers to talk about stillbirth and stillbirth prevention with their patients for expectant parents to understand what's normal for their baby and to speak up if they notice a change. So now let's look at the actual app. Our app is free and it's available in 12 languages. It's also available for Apple and Android products. If you get interrupted during a kick counting session, you can restart your kick counting session or delete a kick if you accidentally track one. We are all busy, and if you're anything like I was when I was pregnant, pregnancy brain was a real thing. You can set daily reminders to help you to remember to count those kicks. After a few days, the expectant parent is going to begin to see a pattern for their baby, and they'll know how long it takes for their baby to get to 10 movements. You can review the kick counting history, download it, they can share it with their provider so that they can discuss it at their OB appointments. Their kick counting history can be useful for those visits. It's what my daughter-in-law did, and it's what she used to share with the doctors, and our Luna is here with us today. The app also will track future pregnancies so that you don't have to create a new account with each pregnancy, and you can manage your account on multiple devices, including the Apple smartwatch. Remember, if your client does not have access to a mobile device, you can also do the same thing with our downloadable kick counting chart if you go to our website at www.countthe.kicks.org and they're able to count those kicks. We call it kicking it old school. We now have a new strength tracking feature. Research shows expectant parents should also be paying attention to the strength of their baby's movement while counting and tracking their kicks. With our new strength tracking feature, at the end of each kick counting session, you'll be asked to rate the strength of your baby's movements. If the baby's movements become weaker, it can be a sign that their baby needs to be evaluated. This new feature teaches them how to judge the strength of baby's movement. You rate the session from fluttery to fierce. Fluttery is going to be the light movements that are difficult to see from the outside, similar to what is felt when you first start feeling baby move. Fierce is going to be those strong movements where you can visibly see baby moving around on the inside. It can literally feel like a limb is going to poke out of their belly. They simply rate the strength of the kick counting session by selecting fluttery, which is indicated by 1 footprint, up to fierce, which is 5 footprints. You can include a note detailing how the session went and what they may have noticed during the session. This note just says baby felt strong like normal. Once they finalize the session, they're going to see a graph showing their strength average as well as the average time that it takes for their baby to get to 10 kicks. If they notice a significant increase in the average time where it's taken baby longer to get to 10 movements, or a decrease in the strength of baby's movements, they need to contact their provider right away. Reduction in fetal movement can also signal anything from low amniotic fluid or a ruptured amniotic sac or a tangled umbilical cord. If a provider's office is closed, hospitals are open 24/7, ready to serve them. The risk of not speaking up outweighs the risk of not going in. We also have another update that we just had, and I'm so excited about this because we now have video capability that educates our users. On our app, you can find baby safe stories, a short tutorial on how to count kicks, new features on our app, and why we count. Let's watch a short video showing how easy it is for expectant parents to use our app and to know how long it takes for their baby to get to 10 movements.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
As you can see, our app is easy to use. It takes the guesswork out of remembering how long it takes to get to 10 movements and empowers moms to speak up if they notice a change. So now that you know more about the Count the Kicks app and how you can implement it into your practice, it's pretty easy to do by having those conversations. Let's take a look at how to have the stillbirth conversation. A common question that is asked is, when and how do I talk about my clients about Count the Kicks and the app? The when. At 28 weeks, you want to start having that conversation if they're in a normal pregnancy. You want to do it at 26 weeks if they are high risk or if they're carrying multiples. The way to discuss this, I always suggest downloading the app yourself first so that you can play around with it, know how easy it is to use it, and be able to walk them through downloading and getting themselves set up. You can ask questions like, do you know about the importance of tracking your baby's movements? Emphasize bonding time, that they'll get to know what's normal for their baby. Follow it up with the benefits of knowing what is normal. Or you can say something like, let's talk about how to track your baby's movements. Share how movements are going to be those kicks, jabs, rolls, pushes, anything except for hiccups, because hiccups are involuntary. Have them to download the Count the Kicks app. A helpful tip I like to share is, One of the best times to have them to download it is when they're waiting on that glucose test. This is a perfect time to download it because they're sitting there and they're waiting. It gives them something to do in between that time. We know and understand talking about stillbirth is not something anyone wants to do, but it is so important. Expectant moms hear about all sorts of different things that can happen to their baby. We talk about the importance of taking folic supplements and not drinking alcohol, not smoking, all of those things. This conversation should be a part of your routine exam with any expectant parent that you come into contact with. Some people think, I don't want to scare moms. Well, pregnancy is full of risks that we talk to moms about. Stillbirth is another risk that moms deserve to be educated about. Some people think stillbirth just happens. There's nothing we can do. There can be warning signs if moms know what to look for. Some people think her baby's always active. It's not a concern. Babies are active until they aren't. Cord and placental accidents can be sudden. Moms need to know what is normal so they can notice a change. Somebody thinks she's almost at her due date. There's no need to even worry about it. The risk of stillbirth increases as they approach or exceed their due date. A lot of times we get questions on what to do or say when talking about fetal movement monitoring with women who have experienced a previous stillbirth. If you're dealing with a mom who has had one, what you want to do is follow the exact same protocol. Since women who have had a stillbirth are more likely to experience another stillbirth, talk about starting to track baby's movements at 26 weeks versus 28 weeks. Feel free to talk about previous stillbirths that they've had and acknowledge their child that was born still. Ask about the name. Ask about the gender if you weren't their previous provider. Stay away from medical terms like fetal demise. This provides a connection with them and assist them in feeling confident that you're hearing them and you understand what they've been through. Ask if anyone has talked about the importance of tracking fetal movement before. Believe it or not, a lot of moms that we've talked to that have had previous live births and even those who have had prior stillbirths have stated they were never told about the importance of tracking fetal movement in the third trimester. Some of the common myths that we hear when asking parents if they know the importance of tracking fetal movement are: only those experiencing a high-risk pregnancy should pay attention to their baby's movement. That is false. All expectant women should be educated on count the kicks and get to know what's normal for their baby. Another myth is, my baby should get 10 kicks in 2 hours. This is also false. Every baby is different, and the recommendation to expect 10 kicks in 2 hours is outdated. Current research indicates moms should work to understand the normal amount of time it takes their baby to get to 10 movements each day. Another myth is, I can just use a Doppler device to monitor my baby's well-being. That's also false. A change of the baby's heartbeat is one of the last things that occurs when a baby is in distress. A change in a baby's movement may indicate potential problems before actual changes in the heart rate are detected. Expectant parents should only use a Doppler device under the guidance of a healthcare provider. Other common myths are, if baby isn't moving, I should drink cold water or eat something sugary to get baby moving. Again, false. Research has moved away from the idea that sugary drinks and the like are a good way to get baby to move. Think of it from this perspective. When we don't feel well, we're not out running marathons. We usually move slower, we move less. Well, it's the same for baby in utero. If they aren't feeling well, we shouldn't try to force them to move by providing sugary drinks or candy. We should investigate why they're not moving. And if they're not feeling well, understand what is wrong. We should also know that kick counts are best monitored without interventions like juice, candy, etc. If baby isn't moving like normal, parents should speak up to their provider right away. Another myth is babies kick less near the end of pregnancy. This again is false as well. Babies don't run out of room at the end of pregnancy. The types of movements they may change. They may have more jabs and fewer rolls, but babies should move up to and even during birth. If an expectant parent is monitoring their baby's movements at the same time each day, it should take about the same amount of time to fill 10 movements. Another is only high-risk expectant parents, triage does not need any Count the Kicks education. Again, false. Labor and delivery triage is the perfect place to have this information. Posters, brochures, and discharge papers all should be used when someone comes in for anything and is sent home. Other ways you can integrate Count the Kicks into your practices, you can use a form at check-in, have your entire front desk staff trained on asking if the patient has downloaded the app and what are the results. How long is it that it's taken baby to get to 10 kicks, just to make sure that mom is really paying attention. It can be included in family care plans or even intake forms. One of the greatest times for them to download that app, again, is when they're waiting on that glucose test. After you check labs, have the nurse to talk about the app and ask the patient to download it while they wait. Lastly, you can add a question that pops up in the third trimester to their electronic medical records or electronic health records to remind you to ask them about their tracking of fetal movement. So if any of you are in labor and delivery and work with labor and delivery, integrating Count the Kicks into your discharge process is another way to integrate Count the Kicks into your daily practice. This is what we would consider our gold standard. If they get checked out and they are sent home for any reason, in your discharge papers or after visit summary, include information on monitoring fetal movements with instructions on how to get it done. How do they complete it? Include information like who to contact, what to do if they notice reduced fetal movement or a change in the strength of their baby's movements. Another opportunity to integrate is we have a pilot with this clinic form. And if you would like to utilize this as a way to hand this to them, and it simply lists it out. Have they been counting their baby's movements? Do they know the importance of counting the baby's movements? Have you downloaded the Count the Kicks app onto your phone? And then they're going to hand this to their nurse and they'll be able to keep the other side of it. If you would like to pilot this in your office, please contact us and let us know, and we can send you some. It's an easy way to help you to integrate counting the kicks and how to offer it to your patients or clients. One of our partners, Celebrate One Columbus, has implemented Count the Kicks into their system by asking their patients if they have downloaded the Count the Kicks app. They educate through an explanation on their intake form. This is a simple and easy way to implement Count the Kicks into your system and start educating your clients and expectant parents on counting and tracking their fetal movements in the third trimester. If you go to our website at www.countthekicks.org, we have a sample course materials and lesson plans for childbirth educators, providing them with step-by-step instructions on how to teach expectant parents the importance and the method for tracking fetal movement in the third trimester. In the lesson plan, we address the common myths shared by expectant parents that we just went over and the truth regarding the misinformation that seems to be still floating around out there. Share this information with your team and make sure they know about the stillbirth prevention campaign and the importance of teaching your patients and clients how to track fetal movement in the third trimester. Now let's talk about some resources that are available to you because of our partnership with the Florida Department of Health. So the question is, now what? Now you have the background on Count the Kicks and how to talk about it with your patients and your clients. Now it's time to order. Thanks to our partnership with the Florida Department of Health, we are so excited to provide our educational materials to you for free. All you have to do is go to www.countthekicks.org, click on order materials, fill your card up with the items that you would like to be able to provide to your clients or the expectant parents that you work with, and go ahead and check out. We have promo posters, how-to posters, app reminder cards, and even brochures. Here's another great example of the partnership that we have with Florida Department of Health. And what we have is magnets that are available for free on our website. When you place your order and you fill your cart and you get ready to check out, the system is going to prompt you asking if you would like to order magnets for free. Each order will contain 50 magnets. If you believe that you're going to need more than 50 magnets, please contact me at my email address, which will be listed in the copy of this PowerPoint that you're going to receive. We also had a pilot where we designed stirrup covers, and it's called Stir Up the Conversation. So if you work in an OB office, this is something that's also still available to you. We sent them out to 102 OB offices, but we still have a limited amount that's left. And if you are interested, they are first come, first serve. If you like any of them, please email us and we'll be glad to get them sent to you. These are some Count the Kick billboards that are coming to a location near you. We're going to have them up in various locations in the state of Florida very soon. Here is a public service announcement that will appear on the Florida airwaves.
Your turn.
Your turn.
Do you feel anything?
She's dancing. Help protect your baby. Download the free Count the Kicks app. Studies show that regularly monitoring a baby's movements helps reduce the chance of stillbirth.
Your turn.
Count the Kicks. Visit countthekicks.org.
What a wonderful way to educate parents. Another great resource we have are the Count the Kicks ambassadors. These are women across the nation that are working hard to share the Count the Kicks education and messaging through their states. They are volunteers, some are lost moms, and others are just passionate advocates due to their own personal experiences. They can help with a variety of things, like doing things like this presentation, attending medical conferences and baby fairs, giving media interviews, and they work to grow partnerships, fundraise, give presentations as an advocate for legislation, and more. Your Florida ambassador is Sarah Siriani, and she saved her son Ryan. A quote from Sarah said, "After weeks of counting and getting to know our baby's movements, I noticed a change and quickly told my doctor. After failing tests, we were advised to deliver. Our son Ryan Joseph was born with a true knot in his umbilical cord. But thankful to our quick response, he was otherwise healthy. I am eternally grateful to this campaign for bringing awareness to me and so many other expecting mothers." Our Baby Safe stories provide powerful insight on the importance of tracking fetal movement in the third trimester. This is a quote from Yeli, Eva's mom. She said, "I'm very grateful that Count the Kicks made me aware of the importance of paying close attention to baby's movements, and also that my provider took my concerns seriously and took action. I pray that my daughter stays healthy and continues to grow to become whoever her heart desires. I highly recommend the app to all the expecting moms out there. Happy and healthy deliveries to everyone." These are the stories and accounts that remind us every day why we do what we do. It's stories like these that will forever change your life. This is one of our Baby Safe stories, and this one's about Nala. Let's hear her mother, Dana, as she shares her experience with counting kicks in the third trimester.
She came back in after she had me put on the monitor and stuff, and she's like, we're just going to take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. Once she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, what if? Definitely to pay attention and count the kicks, I feel like it's important just because had I not, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, because your baby might not be here. You just pay attention, seriously, like it's your baby's life.
Just to recap and bring this full circle, no matter where you work, the process of implementation is still the same. The next steps are for you to familiarize yourself with the Count the Kicks app, order the free materials at www.counttthekicks.org. Again, they're free because of our wonderful partnership with the Florida Department of Health. Designate someone in your office to oversee ordering materials to ensure you never run out of brochures, magnets, or even app reminder cards. Take 3 to 5 minutes with your patient to educate them. Make sure to have the kick counting conversation at every touch point in the third trimester. Make sure your entire staff knows about the campaign and the importance of tracking fetal movement in the third trimester. Use your electronic health records, your intake forms, update discharge papers, etc. to share Count the Kicks with your patients. Remember, hours and minutes matter in preventing stillbirth. Educate your patients and your staff on how to expedite concerns and how to deal with them if a person comes in with reduced fetal movement. At this time, I would like to open it up for any questions that you may have. Go ahead and drop them in the chat. And so far, I'm not seeing any questions that are listed. Other than how could you make sure you are muted? Everyone's automatically muted. Thank you so much, Amy. I appreciate you. Well, thank you so much, everyone, for coming. This has been an amazing time. This concludes, oh, here we go. Is there a minimum of kicks in any time period? We want to make sure that they hit 10. It's very important that 10 is the minimum. And every baby is different, but it should not take longer than 2 hours. So they want to know what is normal for their baby. So maybe my baby takes 15 minutes and your baby takes a half hour. That is okay. But the key is, again, knowing how long it takes to get to 10 movements. And you want to track it at the time where baby seems to be busiest, where baby seems to be very active. A lot of times we find that night after dinner is when baby is most active. So we want to make sure they hit those 10 kicks, and we want to know how long it takes on an average. If they notice that change, then we want to do something about it. That's okay. Thank you. I don't see a problem with starting sooner. And that way you'll be okay with knowing what's normal for your baby and if normal changes. The question was, can you start in the second trimester, the latter part of it, you're 22 weeks and baby is very active. I don't see a problem with starting sooner. That is okay. What is considered a significant change in movement? Is there a percentage? We don't like to give a percentage, and the reason why is because every baby, again, is different. And this is why it's so important to know what is normal for your baby. So what you want to do is, if, let's say for me, if it were me and it normally takes my baby 20 minutes to get to 10 kicks, 20, 25 minutes to get to 10 kicks, and I'm noticing that it's taking like an hour and 15 minutes, I'm going to alert my provider right away. And then maybe the provider can do NSTs or different things to find out what's going on. They can determine what tests need to be ran after that. What is considered significant change? Yes, that's already been answered. So we answered those two live. We received the gray and aqua wristbands. Is there a difference in the wristbands? No, there's no difference in the wristbands. The wristbands are all the same, and you just use them to actually count the fetal movements. It's just a way to remember which, because you're counting without the app by using the wristbands, it just reminds you of which kick you are on. These are all great questions. Keep them coming. Are the OB providers really involved? Yes, there are OB providers who are involved and they want to know. There are others who still question the research that has been done. The research, we have tons of research. If you're into it on our website, definitely go and check it out and read it. There are some who fight against the research. But again, my granddaughter is living proof, and my sister not counting and tracking fetal movement in the third trimester, not knowing to do it, and then sharing with her doctor something was wrong. What we found out after Jasmine was born still is that her cord was too short. And because the cord was too short, as she was trying to move through the birth canal, what ended up happening is it restricted the blood flow and the oxygen. And unfortunately, Jasmine was born still. Had we have been able to track her fetal movements in the third trimester, had there have been a Count the Kicks app back then, I honestly believe that Jasmine would be with us today. Awesome. All right. Well, if there are no other questions, this does conclude our CHES credit training. Again, thank you to the Florida Department of Health for this training and for the free materials that we are able to provide you all. And thank you for joining in the fight to improve birth outcomes in the great state of Florida. Have an amazing day, and we'll talk with you soon.